There is a truth that few people dare to say out loud. Many patients take their blood pressure medication every day, yet their blood pressure still goes up and down, never stable. Why? Partly because some doctors lack experience and prescribe the wrong group of drugs not suited to the patient's condition. But another big reason lies with the patient themselves, careless skipping doses, forgetting pills, or taking them the wrong way. The two mistakes together mean blood pressure swings high and low, while the brain, heart, and kidneys are slowly being damaged day after day. Think about it. If a doctor prescribes a beta blocker for someone with asthma, that's practically inviting an asthma attack. If they prescribe thiazide diuretics for a patient with gout, the joints will flare up in pain. Even ACE inhibitors or ARBs without monitoring potassium and kidney function, a patient could end up with life-threatening hyperkalemia. Blood pressure medication is not one size fits all. It has to be the right drug for the right person, in the right situation. But mistakes from doctors are only one side of the problem. Patients themselves can be even more reckless, and I have to be blunt. Many patients destroy their own health because they take their medication lightly. Some people take pills when they feel like it, remember one day, forget the next, not realizing that skipping just one day can send their blood pressure spiking, putting them at risk of stroke that very night. Others see their numbers back to normal and decide to stop on their own, forgetting that it was the medicine keeping it normal in the first place. Some listen to neighbors who say, Western medicine hurts your liver and kidneys, stop and drink herbal tea instead, and a few months later they're lying in a hospital bed after a stroke. Others avoid follow-up appointments, never checking blood work or electrolytes, while the drugs quietly cause complications they don't even notice. Every drug group has its strengths and weaknesses. ACE inhibitors like enalapril or lisinopril protect the heart and kidneys but can cause a nagging cough or high potassium. ARBs like losartan or valsartan have fewer cough issues, but still need kidney monitoring. Diuretics lower pressure quickly by flushing salt and water, but can drop potassium and trigger gout attacks. Calcium channel blockers like amlodipine are very effective, but patients often complain of swollen ankles or flushing. Beta blockers slow the heart and ease its workload, but cause fatigue, sometimes affect sexual health, and are a disaster for people with asthma. Spironolactone is helpful in heart failure but can raise potassium, and even cause breast enlargement in men. You see, no one can simply copy what works for a friend. Choosing the right drug requires medical judgment and strict patient discipline. When used correctly, blood pressure drugs are a shield protecting your brain, heart, and kidneys, but used the wrong way, they can be a double-edged sword. That is why there are golden rules. Take your medication consistently at the same time every day. Never stop or change the dose on your own. Keep your regular checkups, get blood work, and monitor your organs. Always tell your doctor about every pill or supplement you're taking, even herbal remedies, because dangerous interactions are real. And remember, medicine controls your blood pressure, but lifestyle keeps you healthy in the long run. Eat less salt, exercise regularly, quit smoking, limit alcohol, and get good sleep. There's a saying worth remembering: people don't die because they take blood pressure medication. They die because they take it the wrong way, or not at all. A doctor may not always prescribe perfectly, but if the patient is disciplined, follows up, and takes responsibility, blood pressure can still be controlled. On the other hand, if the patient is careless, skipping, stopping, or listening to bad advice, then even the best medicine won't work. Blood pressure medication is not a burden. It's the shield that guards your heart, your brain, and your lifespan. Staying disciplined with your pills is not just about you, it's about giving peace of mind to your whole family.